Welcome to the Pre-Admission Conference for the Medical Laboratory Technician Program at Maysville Community and Technical College. Medical laboratory technicians play a very important role in the healthcare delivery system. MLTs work behind the scenes performing tests on blood, body fluid, and tissues in all areas of the clinical laboratory. 70 to 80% of all testing performed in the clinical laboratory is used to diagnose, monitor, and treat patients with disease. The program is offered in a face-to-face format on the Maysville campus and in a hybrid format on the Rowan campus. Upon successful completion of the program, you will earn an Associate in Applied Science degree as well as an Embedded Phlebotomy for the Healthcare Worker certificate. The program takes 4 semesters to complete once admitted. My name is Michelle Thurlman, and I'm the coordinator for the Medical Laboratory Technician Program at MCTC. I can be located on the Maysville campus in the Science Building on the 2nd floor in room S304A. In this pre-admission conference, I will be covering the application process to the MLT program, where the application materials can be found, how to complete the application packet, specific program requirements for the MLT program, how the selective admissions process works, the health screen requirements as well as criminal background and urine drug screen requirements, how you are notified of acceptance to the MLT program, financial aid and scholarship availability, and remember, the deadline for application to apply to the program is May 1st. Here's an overview of the Medical Laboratory Technician program. You are required to apply for admission to the college, which you can do through the MCTC website. You must complete your application for admission to the college, and that will require a transcript from any other institution which you've attended. You must attend at least 1 pre-admission conference per admission cycle, which this video counts as. You also should successfully complete Math 110 or higher with a grade of C or better preferred. You must also have a GPA of 2.0 in all of your college course week to be considered for the MLT program. Our general education courses consist of English 101, Math 110 or higher, a communications course, a computers course, a heritage humanities course, introductory to general chemistry, Bio 135 basic anatomy and physiology, or Bio 137 and 139, plus general psychology. The program is accredited through the National Accrediting Agency for Clinical Laboratory Sciences. Math 110 or higher must be completed prior to beginning the program. The first semester of the program, your MLT course load consists of applied phlebotomy, phlebotomy clinical experience, and introduction to clinical diagnostic microbiology. So some of those other general education courses can be completed at that time. The second semester of the program and third semester of the program, you have a full MLT course load. So any other general education course requirements should be completed during the summer between your first and second year. Now the fourth semester of the program, your final semester, you complete approximately 600 hours of clinical practicum in a hospital clinical laboratory of one of our clinical affiliates. So if you do have an outstanding general education course at that time, it can be taken online, but remember, you must complete it successfully in order to graduate from the program. So where can you find the application for the program? The application materials as well as the information materials that I'm going to discuss today can be found on the MLT website through the MCTC webpage. So we'll go and discuss how you're going to complete that application, what's considered a complete application. Make sure that you are completing and filing by the deadline so you can be considered for admission for fall, because incomplete applications will not be considered, and I've had that situation occur before. The deadline for applications is May 1st, so that does allow several months to complete those. Application to the program does not guarantee admission. There is a selective admission process that we will discuss. You will be notified whether you're admitted or not via KCTCS email. No information will be provided by phone regarding acceptance or denial. So make sure you're checking your KCTCS student email account often. I also ask that you provide an alternate email address on your application forms as well. You will want to mail the application materials to my attention at the Maysville campus. Do not overnight or send them via special mail. So part of your information materials include the MLT program, mission, and philosophy. The program will prepare you to play a vital role in the local healthcare delivery system and become adept in collecting and analyzing medical specimens for medical diagnostic purposes. We give you the opportunity to acquire the necessary skills to work under the supervision of a registered clinical scientist or pathologist in a clinical lab, hospital, or other health agency. So you'll learn about collection of specimens from patients, as well as performing laboratory tests in all areas of the clinical lab, including immunohematology or blood bank, clinical chemistry, hematology, microbiology, serology, and urinalysis. You must achieve a minimum grade of C, which is a 74.50 or above, in your MLT courses. And upon completion of this program successfully, you will be eligible for National Certification Exam as a medical laboratory technician. Any adult 18 years of age or older will be considered for admission to the MLT program as long as you meet the specified requirements for the college as well as the program. The MLT program objectives and competencies. You will learn to perform laboratory tests in all areas of the clinical lab, maintain lab materials and equipment, prevent and detect technical errors, solve problems as they occur in the clinical lab, carry out an established QA program, follow established clinical laboratory safety guidelines, demonstrate responsibility for your own behavior and dependability towards required duties, follow all institutional policies while applying the principles for medical ethics, demonstrate professionalism as well as a satisfactory working relationship with peers and clinical instructors, exhibit enthusiasm and initiative towards all subject areas, and recognize your own limitations and seek help when necessary. So our goal is for you to be able to define and identify the basic principles, procedures, and fundamental characteristics related to all areas of the clinical lab. So you'll be able to select, prepare, perform lab procedures, including specimen collection, instrumentation, reagents, and controls related to all areas of the clinical lab. You'll learn to problem solve and calculate results from supplied information and or obtain data as it relates to all areas of the clinical lab. You will be able to associate lab findings, clinical information, and QC data in order to determine the accuracy of the routine test results related to microbiology, hematology, clinical chemistry, urinalysis, serology, and blood bank. You'll be able to evaluate, analyze laboratory procedures and or findings in order to find or recognize common procedural and or technical problems, as well as take corrective action according to predetermined criteria in microbiology, hematology, chemistry, body fluids, immunology, and blood bank. And you also maintain a solid foundation in general education courses. Our career level entry competencies include collecting, processing, and analyzing biological specimens and other substances, performing analytical tests of body fluids, cells, and other substances, recognize factors that can affect the procedures as well as the results and take appropriate actions within predetermined limits when corrections are necessary, perform and monitor QC within predetermined limits, perform preventive and corrective maintenance of equipment and instruments or refer to appropriate sources for repairs, apply the principles of safety, interact cooperatively with other laboratory personnel, healthcare professionals, and with the public, recognize the responsibilities of other lab and healthcare personnel and interact with them with respect for their jobs and patient care, apply basic scientific principles in learning new techniques and procedures, relate lab findings to common disease processes, and establish and maintain continuing ed as a function of growth and maintenance of professional competence. On the website, you will be able to find the informational materials as well as the application materials for the MLT program. We have already discussed some of the information materials that are included in the informational packet, but additional materials included in that packet include the Selective Admissions Assessment form, which is how your application will be reviewed. Previous college course experience, grades achieved in science and math courses, college GPA, whether or not you've completed all courses at MCTC, if you have healthcare work experience, and also ACT scores if you have taken that test. You will be assigned points based upon this point system. Estimated program fees. The tuition can vary from year to year, but is listed there. Textbooks. The great thing about our textbooks is we use the same textbook for introductory and advanced courses. We do have an ExamSoft, which is an examination software that we can use. We also utilize Media Lab Exam Simulator in the final semester of the program to help students prepare for that national certification exam since they are out in the clinical setting. Uniforms consist of scrubs, lab coat, and clean, neat shoes. I do have disposable lab coats available for use in the student lab on campus. And typically in the clinical setting, students are provided a lab coat if necessary. You do need at least one pair of red scrubs, which is our program color, and a nice white clean lab coat for graduation pictures as well as pinning ceremony. Castle Branch is a web-based receptacle for background checks, urine drug screens, and immunization records. The cost of that is $125. Any additional immunizations or blood work required, of course, is going to vary depending upon where you obtain it. The color deficiency test can be administered here on campus by me. Liability insurance is rolled into your tuition and fees each semester if you are enrolled in a health science program. As far as graduation expenses, cap, gown, MLT pin, those are listed there and can be obtained through the bookstore. The Medical Laboratory Technician National Certification Exam fee is listed there, and that is through the American Society for Clinical Pathology. I have also listed the Phlebotomy Technician Certification Exam fee, but Kentucky is not a state that requires phlebotomists to be certified, although I have had students in the past who have opted to take that certification exam. We do have a one-time student organization fee of $10. Our student organization does fundraisers, community events, campus events, and I do encourage students to get involved with that, as well as state meetings. Clinical rotation is dependent upon the student. The first semester, you have a phlebotomy clinical rotation. The final semester, you have a clinical laboratory rotation. So students should be prepared to travel 50 to 70 miles one way, and those transportation costs are dependent upon the student. Most of our clinical affiliates, especially for the clinical lab rotation, can only accommodate one student at each site. You must maintain a 74.50 or C grade in the program to continue with the proper sequence of courses. If you do not, you can continue in sequence, but your completion will be delayed by a year. In order to continue, you would have to submit an application for readmission. You would have to meet current guidelines for admission to both the college and the MLT program, attend a pre-admission conference and complete the appropriate materials, and make sure all those documents are signed. And of course, readmission will be dependent upon available resources. A student may be readmitted to the MLT program no more than twice, because all MLT courses must be completed within 3 years. Once admitted to the MLT program, there are some health screening documents that are required. The color deficiency evaluation, which can be performed by an optometrist or here on campus by me. Proof of professional liability insurance, which is included with your tuition and fees each semester as a health science student. Hepatitis B immunization, which is a series of 3 shots over 6 months, or hepatitis B surface antibody testing showing immunity, or a declination waiver can be signed. A urine drug screen is required within 6 months of clinical rotation, as well as a criminal background check within 6 months of clinical rotation. A record of 2 immunizations or IgG titers drawn for rubella, varicella, mumps, and measles is required. A tetanus that is within 10 years time frame. A 2-step TB skin test, which is 2 TB skin tests within 3 weeks of each other, or a quantiferin TB gold or chest x-ray. Flu shot and COVID vaccine are also suggested simply because the time of year we are in clinical rotation at our clinical affiliates. The second packet of information that can be found on the website is the actual application materials. The first of these forms is a student data form. You want to make sure to complete your personal information, including your KCTCS email as well as a personal email. Also make sure that you designate which campus you are applying for, Maysville or Rowan campus, as well as the year of admission. The second form is a technical standards form. So by signing this form, you state that you possess sufficient visual acuity and color perception, sufficient gross and fine motor coordination to implement lab skills, sufficient communication skills to interact effectively, and also sufficient intellectual, emotional, and physical functions to plan and implement lab duties in a responsible manner. The third form is a statement of understanding. Because we do require a period of assigned guided clinical experiences outside in our clinical affiliates in the community, for educational purposes, you will be practicing on live models or live patients. Students will be practicing on your specimens. You'll be practicing on their specimens. We do use live or real specimens in the student laboratory under training. And then, of course, when you're out in the clinical setting, you will also be exposed to those live patient samples. So no guarantee or assurance has been given by any representative of the college as to any problem that might be incurred as a result of those procedures. Remember, the assigned clinical experience is for educational value only, so no payment should be expected or will be earned. Understand that as a student, you will conduct yourself accordingly, following all required and published personnel policies, standards, philosophies, obtaining all health screening tests, immunizations, criminal background checks, and drug screens required by that agency. You will adhere to the school's policies, rules, and regulations. Understand that any information regarding a patient or former patient is strictly confidential and should only be used in the clinical setting. Understand that your educational experience and knowledge you gain during the program do not entitle you to a job. However, if all objectives and licensure requirements are attained, you are qualified for a job. Understand that any action on your part inconsistent with the above may result in suspension of training. You are liable for your own medical and hospitalization expenses, and you will carry a minimum liability, which is enrolled in your tuition and fees each semester as a health science student. The optional form is the healthcare work experience documentation form. It does have to be required to be completed by an HR representative at your facility of work. Again, that's optional because not everyone is going to have healthcare work experience. And it's not a make or break as far as points are concerned on your application. The final form is a form that you must sign to state that you have listened to this online pre-admission session, you understand everything, and it does require that you put a pre-admission conference verification code on the form, so make sure that you listen to the end. All of these forms must be signed and returned as part of your application for the MLT program to me, Michelle Thurlman, at the main campus, Maysville Community and Technical College, 1755 U.S. Highway 68, Maysville, Kentucky, 41056. Once you've completed your application materials and mailed those to the attention of Michelle Thurlman at the Maysville campus by May 1st, those applications will be reviewed and recommendations will be made to the MLT Admissions Committee. Applicants will be notified of admission or denial via the emails provided on the application. Once you are notified and you've been admitted, there is a response form which must be returned to me, Michelle Thurlman, at the Maysville campus, accepting or declining your admission into the program. New admits will then be block enrolled in the MLT courses for the fall semester. If you have been denied, you can certainly apply the following spring for fall admission again. Medical laboratory technicians are in very high demand. The current laboratory workforce has several who are retiring with not enough new laboratory professionals to fill those open positions. Our current program graduates are starting at $25 to $30 per hour or $52,000 to $62,000 per year. A lot of those graduates are obtaining full-time positions from their clinical practicum in the final semester of the program. We have several clinical affiliates located in both Kentucky and Ohio. So some of our graduates are working at places like UK St. Clair, University of Kentucky Med Center, Clark Regional Medical Center, Harrison Memorial Hospital, Bourbon Community Hospital, Georgetown Community Hospital, Adams County Regional Medical Center in Ohio, Mercy Claremont in Ohio, Meadowview Regional Medical Center, Fleming County Hospital, So we have graduates spread far and wide. And I also have graduates who are travel techs, meaning they take contracts in other states for short periods of time. And so you can make even more money that way by becoming a travel tech. So this is a very high demand, high wage career choice. The 3-year rolling national certification exam pass rate for the program is 92%. Graduation and employment rates for the program are 100%. Several graduates from our program have went on to complete MLT to MLS online programs through the University of Kentucky, the University of Cincinnati, and the University of Arkansas for medical sciences. Of course, hospitals, the clinical laboratory is the primary employer, but also physician office laboratories, reference laboratories, veterinary laboratories, chemical, pharmaceutical, biotech, research, and public health laboratories are also employment options for graduates of the MLT program. There are financial aid and scholarship opportunities for the Medical Laboratory Technician program. The Work Ready Kentucky Scholarship Program is available for students in the program. The Workforce Innovation and Opportunity Act is administered through TENCO, and there are career centers in Ashland, Maysville, Moorhead, and Mount Sterling. Our national and state organizations like ASCP, ASCLS, and KSCLS also have scholarship opportunities for students, as well as MCTC. Thank you for attending. Feel free to reach out and contact me if you have any further questions. And your conference code is MCTC Proud MLT. Have a great day.